Welcome, everyone. I'm Katie Richardson, Vice President of Clinical Relations with Angel MD, and I am super excited to have Dr. John Dayton with me today. John is a clinical instructor and innovation fellow at Stanford's Department of Emergency Medicine, and we are going to talk to him about some really innovative emergency medicine startups today. John, I know that the ACEP 2021 annual meeting is going on now in Boston, but you recently featured the Digital Health and Device finalists from ACEP 2020 Innovation Awards in a couple of articles. One of those finalists actually is, we're going to hear from in just a few minutes, Retrieve Medical, and we would love to learn a little bit about the other three.
Sounds great. So the other three are built around fixing problems related to scheduling and appropriate triage. And the last one actually is setting up a way to do consultation based on physician specialty that may not be in your community, or maybe you want a second opinion. And so that's what they're built around. So the first one's called Informatica. They built a symptom checker called Symptomate. And the goal for that is to use this as kind of a patient-facing app. There's several algorithms based on complaints, and then it helps them triage, well, maybe we can set up an appointment for this patient versus have them go to a virtual care visit versus refer them to the emergency department. And the goal for that is to make sure use the resources appropriately and triage the patients in a way that's safe, but is also cost effective. And so that was one of the other groups. Cipher, a company out of Colorado, they built what's called Flow, and it's a scheduling software. Rather than your typical Excel spreadsheet and your times and your blocks, they take cues from the electronic health record to see when they're the busiest, where they need more staffing and where they need less staffing, and they build that around models that come from the electronic health record. The goal for that is to avoid having shifts where people are inundated versus shifts that are a little too light. And they have some initial pilots that show that increases satisfaction. They've used it with the nurses so far, and they have a physician version that they're building right now. And then that last version I was mentioning, this is Right Health. So Right Health is the second opinion platform, and it's a kind of a combination of a bunch of physicians with their specialty, and they have information about their research and their patient feedback, and then that's matched up to patients that are looking for a second opinion. So they're basically a virtual second opinion company. And so that company actually also has a Colorado player. I know that's near and dear to your heart since that's where you are and Angel MD is, and that's Arlen Myers is one of their leaders, and he's also the founder of Society of Physician Entrepreneurs.
To tell us a little bit about the devices. So four
Sure.
device finalists as well, correct?
The one that I'm most excited about is a company called Hyperfine, and they've built an MRI called Swoop. The reason this one's such a game changer is typically for an MRI, the patient has to be very stable. They need to go to another room. It's 45 minutes. There's a lot of banging. It's uncomfortable for the patient. But there's situations in the emergency department where we'd like that information from an MRI without having the patient leave the ER or needing to get them to a point where they're so stable that that information is already available to us anyways. So these are some of the perks for Hyperfine's MRI. It is a portable system that you actually bring to the patient. It fits through a regular elevator size or ER room size door, plugs into an electrical outlet. You can interface with an iPod. And you don't need a huge budget for a dedicated MRI tech, an MRI suite, something that can go bedside. Now, the downside is your images are more rapid. It's not going to be the complete, beautiful MRI image, but you have information that you can use to treat the patients within the next couple of minutes, all while doing it from the ER room, all while they have a family member that can hold their hand around metal, which is obviously different than the traditional MRI.
Yeah, well, John, thanks for being here with us today. And we look forward to not only reading about those companies and your articles, but catching up with you again soon.
Sounds great. Thanks for having me.